I can only speak for myself, because I am just one practitioner with my own unique perspective and unique clinical experience. But I personally view mental health presentations as symptoms, or I at least approach them clinically in this way, because our symptoms are never random and without a collection of underlying causes that are behind them. So, it's important to understand, physiologically speaking, that we are designed to have symptoms when we're living out of alignment. And our evolution can only support so much wrong living by design. It can only handle a certain amount of stress, chronic stress, and it can only handle a certain amount of toxicity and of being disconnected from nature and not sleeping, right? So if we can learn to view our symptoms, whether they are anxiety or fatigue, insomnia, depression, if we can start learning to view these as our bodies trying to communicate with us that we are out of balance. It is designed to do that for us. And if we view it this way, then we essentially can choose to exert curiosity around our symptoms rather than fearing our own body. It's a much more empowering mindset to have. So, our mental health is inextricably connected with our physical state of health. Now, this is not to say that there are not social, psychological, emotional, and trauma-related factors that affect someone's mental health. But it is essentially near impossible, I would say, to do the deeper work around those things if we have physiological imbalances which are directly linked with driving our mental health symptoms. That deeper work, it must be facilitated by a stable nervous system for it to be effective, for people to be able to sit with their stuff and process it. I discuss with clients quite regularly the need to send a signal of safety to our nervous system. In order for us to heal any sort of illness or imbalance, we must be sending a signal of safety to our nervous system. If we are in fight or flight, we are designed, the body is designed to break down if it is in that stress state for too long. So we essentially send a signal of safety through basic lifestyle choices, by addressing nutrient deficiencies, modifying our diet, restoring our gut microbiome and improving our digestion, proper breathing, reducing toxicant exposure, sleep hygiene, having a support network and a sense of community, There are a whole range of variables to consider when we are looking at mental health, and everyone's situation will be different, I'll say, naturopaths particularly work quite deeply with something called HPA axis dysfunction, which is a kind of fancy medical diagnostic term for the dysregulation of our body's stress hormone network. And this is documented in papers and trials, and it is widely observed in patients, especially with severe mental illness. So the whole stress hormone, adrenal thing, it's not a health fad. It is a real physiological manifestation of someone who has had chronic stress, and which is directly linked with driving depression, anxiety, chronic fatigue, and insomnia. And so it's worth highlighting these things, such as HPA axis dysfunction, microbiome restoration, environmental toxicity, because these are variables that are unfortunately not considered by mainstream and conventional medicine. And why I think, in my experience, meeting so many people, it's kind of a reason why a lot of clients end up in my office and in the offices of, many other naturopaths and functional medicine people, because they have been told that it must their symptoms must be purely psychological because they can't find anything. But I find these clients come in and they are starting to sense on some deeper level that this isn't the case, that they do feel something physiologically is off, and we, look into all of it. This traditional psychiatric model of mental illness being related to a chemical imbalance in the brain is too reductionist, and it's too simplistic. There's not even really great evidence for it, So, like I've said, there are a huge, wide range of variables to consider that can affect us physically, and it is not ever going to be as simple as one drug or one supplement for one chemical imbalance. If that really worked, mental health rates wouldn't be through the roof.